Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, May 27, 2021. We're honored to be here on the territory. Tomorrow, Friday, at approximately 3 o'clock, we will be providing a written briefing on news relevant to the COVID-19 pandemic in British Columbia, and we'll be back in Victoria on Monday to give a regular briefing at that time. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. To start with today, we've had 378 new cases of COVID-19 diagnosed in British Columbia, bringing the total number of people with COVID-19 to 143,264. Of the new cases, 98 were people who lived in the Vancouver Coastal Health Region, 189 are people in the Fraser Health Region, 9 were people who live in the Vancouver Island Health Region, 68 people in Interior Health, and 14 people in Northern Health. We currently have 3,543 active cases across British Columbia, 286 of whom are hospitalized, 88 in critical care or ICU. And 137,929 people are recovered from their acute illness. Sadly, today we've had an additional 7 people who have died from COVID-19 in the province, bringing that total to 1,690 people. Of the 7 who passed away in the last few days, 1 was a person in their 60s, 3 were in their 70s, and 3 were people who are seniors and elders over the age of 80. As always, through this very difficult time, our condolences go to those who have lost loved ones, to their families, to their caregivers, and to their whole communities. We mourn their loss. We have no new outbreaks to report and have now 4 active outbreaks in long-term care assisted living or independent living and 2 in acute care. Earlier this week, the details of our BC Restart Plan were shared with everybody, and I just wanted to provide an update today around faith services. As many people know, we've been having ongoing meetings with faith leaders and have updated the PHO order and a variance that we had been planning to have in place for a trial period of indoor faith services prior to our circuit breaker being required in March. As this has now been updated, thanks to the work of the group that we have been working with, and the updated variance has been posted today, and guidelines about how indoor faith services can be started today safely, and that includes allowance for up to 50 people at indoor faith services with detailed COVID safety plans in place. And I just want to express my gratitude to Dr. Robert Dome and the wise counsel of the faith leaders who worked with us to develop these guidelines, and I look forward to our ongoing revision and opening up of all indoor faith services in the coming steps of our Restart program. I also want to let people know that we've been working with the camps associations and our provincial health officer order about overnight camps for children and youth will be amended in the coming days to allow them to happen this summer with specific conditions, and we're working those out with the appropriate associations. So further details will be posted as soon as next week. So I think that's good news for later on, again, in the summer. I'm also incredibly pleased to report that we've reached another milestone in our immunization program, in that we've delivered over 3 million doses to British Columbians of COVID-19 vaccines. So 3,032,811 doses of all 3 of our COVID-19 vaccines have been administered in British Columbia. Of those, 156,730 are second doses. So this equates to 65.8% of adults 18 plus, or 62% of all eligible British Columbians 12 and over right now. So these are exciting times, and this is exciting news. And we know that these vaccines work. They're safe, they're highly effective, and simply put, are saving lives across British Columbia right now. As you know, our strategy for immunization has been to provide as much protection as quickly as possible to as many people as possible, to try and decrease transmission in our communities and provide that important level of protection to as many people as possible quickly. This has meant that we increase the interval between dose 1 and dose 2 to as long as a maximum of 16 weeks. Because these vaccines are so effective, our focus has been to get that, as I said, that level of immunity up in communities across the province, starting with those most at risk, including people in long-term care, as we know, as well as our elders, our seniors, and communities across the province. We are making great strides, and we want to keep this momentum going. We now have sufficient confirmed deliveries of vaccine in our age-based program, that's the Pfizer and Moderna vaccines, that we can move up the interval. We've started to do that as more vaccine became available in the last few weeks and moved it up to people getting their invites for second doses at about 13 weeks. And now, for most people, we'll be moving it up to about 8 weeks. Essentially, it is important to remember that the second dose is both protection for you and added protection for us as a community. But this second booster dose is important for your own individual protection. It ensures that you have maximum protection for the maximum amount of time. So we know that the booster dose builds on the antibodies and the cell response that you get from your first dose and provides more durable and longer-lasting protection. So second doses are incredibly important for all of us, and we need to make sure that those who are most at risk get this added protection as soon as possible. Our second dose program is based on the same principles as the dose 1. Those at greatest risk will be at the top of the list for dose 2. That means our seniors and elders, Indigenous people, and people we've identified as clinically extremely vulnerable. We know that age is the biggest determinant for risk of serious illness and death, and we see that even with a high degree of immunization in people with a first dose. That's why, from our start of our program, we have taken this age-based approach for the main part of our immunization program, and that will continue with dose 2. Now that we have a steady supply coming to BC, the number of people who now have their first dose is high enough that we're able to speed up delivery of second doses for the age-based and CEV immunizations. So the standard, as I mentioned, has been as a maximum of 16 weeks. We're now moving that up to 8 weeks for the age-based and for our clinically extremely vulnerable streams. So about 400,000 people over the age of 70 and clinically extremely vulnerable will start receiving their invites today. And it took some time for us to reprogram our system to be able to do that automatically. It started this morning, as of about 7 o'clock this morning. We've started putting out the invites to those people who are over age 70 and people who are clinically extremely vulnerable. And this is how things will work going forward. Early this year, as you know, we had a panel of experts led by Dr. Maureen O'Donnell at the PHSA, who identified the clinical conditions for whom it was important that people got protection early. And those are the same people who will be in line first to get the second dose of vaccine. These people received a letter from me, and they're registered in our system, and they started to receive immunizations that coincided for the same age group of 75 to 79. Because of the limited supply we had, though, back in March and into early April, we had to phase in people with clinically extremely vulnerable conditions. And so people didn't receive the letters and their immunizations, and it was stretched out over a period of about 6 weeks. Now, with the vaccine supply that we have, everyone who is in that category will be notified at once and will be eligible starting today. So you will be able to book those appointments. Some of them will even be as soon as today and tomorrow. However, it does take some time, but people can expect to receive that invitation between now and the weekend. And everybody identified will receive an invite to book within the next few days. You're essentially first in line, along with those people in our province who are most at risk, and that is our elders. In addition to providing, moving ahead our age-based clinics in our community and mass clinics, we've also been going back and providing second doses to people in long-term care and residents and healthcare workers in long-term care. That second dose is underway, that program, and we expect to have all of long-term care and assisted living completed within the next few days to weeks. In addition, for First Nations communities and other more remote and rural communities where we did a whole-of-community approach, we will continue to take this approach for second doses, and we're working with the First Nations Health Authority and with the regional health authorities, and those are starting to happen as well. There are some communities where we've gone in for second doses already, and more will be coming in the coming weeks. There's no need, if you're in one of these communities, for communities to reach out. We will be coming to you, and we're coordinating that with the First Nations Health Authority and the regional health authorities. I do want to say, though, that we have had, over the last number of months, some challenges with receipt of supplies of Moderna vaccine. And I know that is a concern for many people, in that many of our remote communities and early on, people did receive Moderna because it's much easier logistically to travel to those, for Moderna to be taken to some of the more rural and remote communities. We are prioritizing the supplies of Moderna that we have right now to be able to make sure that when we do communities who receive Moderna for their first dose, they can receive it for their second dose. But recently, the National Advisory Committee on Immunization has reviewed again the evidence around interchangeability of vaccines, and they've updated the guidance, confirming that while it is always preferable to have the same product for the first and second doses, in some cases that isn't possible. There are a number of reasons for this. People can have an adverse reaction to a dose, or they simply don't know, or that vaccine may not be available. If that is the case, we now have good evidence that it's safe to have an alternative with the same type of vaccine. So in this case, we're talking about the messenger RNA vaccines, and we have Pfizer and Moderna are both the same type of mRNA vaccines. So it is safe, and it does work if you had a Moderna vaccine first, that you can receive a Pfizer vaccine for your second dose. This is the approach that we will be taking. As much as possible, we are going to try and make sure everybody gets the second dose with the same product they had for their first dose. But we know that some issues with the shipments of Moderna might mean that people who received Moderna in one of the mass clinics, large community clinics, may be offered Pfizer for their dose 2. And I would encourage people to take the Pfizer if it is on offer. We have just heard today that we are going to be receiving more shipments of Moderna, but we know that it is safe and works just as well if you have one or the other of the mRNA vaccines. So we're only talking about Pfizer and Moderna, and in some situations, we expect it not to be common, but in some situations you may be offered a Pfizer vaccine instead of a Moderna for your dose 2. This is only an issue with Moderna, and we will try as best we can to make sure that people do get Moderna if they had that for dose 1. But if it's not always possible in the next few weeks, we expect the supply of Moderna to level off by the end of June. So I just want people to be aware that this may happen and that we are confident that it is safe and effective. The other complicating factor, of course, is the AstraZeneca vaccine program. For people who have received AstraZeneca, this would be through a workplace, through a pharmacy. I'm asking you to hold tight for a few more days. What we have seen is that this vaccine has a better response with a slightly longer interval between doses, and that's from the clinical trials up to 12 weeks, had a better response. So we are looking at what that means for people here in BC, and we are waiting on the results of studies that are being done, particularly in the UK, but elsewhere as well, working through as well the operational and logistical issues of how to get vaccine back to the places where people received it for their first dose. So our focus this week is on the age-based program, and I anticipate we'll have more information by the end of next week to be able to provide advice to people who've received AstraZeneca so they can make an informed decision about receiving AstraZeneca as your second dose or receiving one of the mRNA vaccines. We don't have all the information yet, but we expect to have that very soon, and we're working out the logistics with pharmacies as well. We also have, I want to assure people that we will have enough of the AstraZeneca vaccine to provide second doses for everybody who wants that. I know there has been an issue in Ontario where some people have been offered their second dose because of expiring stock that they had on hand, and I can assure you that's not an issue that we have here in BC, that our AstraZeneca that we have now that we're holding for second doses, it does not expire until the end of June. So we still have a little bit of time so people can make their best decision. So I can't overemphasize the importance right now of getting registered in our immunization registration system. It's your ticket to getting your second dose faster as well. As you know, we vaccinated a lot of people before the Get Vaccinated system was up and running, and that was about the middle of April. We weren't going to wait for the system. But for everybody who did receive their vaccine before the registration system was up and running, we do have your name, your personal health number, your mailing address, and of course, know exactly which lot of which dose of which vaccine you received. But what we don't have that's in the registration system is an email or phone number. That means if you're not registered in the system, you can't get these automated text or emails to invite you to book your dose 2 appointment. If this is the case, we are sending out letters to everybody. You will receive a letter from me letting you know that you can book your appointment for dose 2. Everyone will still be notified, and everyone will still be able to book once you are notified. It just may be a bit delayed if you're one of the people who has not yet gone on to the Get Registered system. So you do have that option right now. If you received your vaccine in one of our clinics prior to April 15th, and you have not yet gone on and registered, I encourage you to do that today, and that will just quickly give you access to the second dose as well. So what does this all mean? First, we're accelerating our dose 2 for our age-based whole of community, our age-based program, and people who are clinically extremely vulnerable. 2 second doses are underway, and like dose 1, we're gaining momentum on second doses as well. These, with the availability of supply, I anticipate that everyone will be able to have their second dose by the end of the summer. And that's important. It's important for us as we move into what we hope will be step 4 in September, where people will be protected, going back to school, going back to university, and getting back into many other things that we want to do in our lives. Our vaccines are safe and effective. They are saving lives, and this needs to be celebrated by all of us. If you've not already done so, please get registered and get vaccinated today. It's simple, it's fast, and getting vaccinated is important and integral to restarting our province and our lives. It's how we will get a handle on this virus and move out of this path of the pandemic. Join millions of us already who've received the vaccine, and let's get as many people protected as soon as we can. And let's everybody do our part in the meantime to try and stop the transmission of this virus in our communities as more and more of us are being protected. And let's, of course, remember to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry. And I wanted to start by expressing my sorrow, my condolences to the families, the friends, the caregivers of the 7 people who passed away related to COVID-19 in the last 24 hours, 5 in the Fraser Health Authority, 2 lived in the Vancouver Coastal Health Authority. While the situation is, where some restrictions are being eased, this continues to be a difficult time for many people, and when you lose a loved one, it's always a difficult time. So I want to express, as people are living through that grief, our support and our condolences and our sharing of that grief today. I wanted to note that more than 3 million vaccinations delivered is an extraordinary achievement, really, of public health in the province of a public healthcare system that has done so, giving priority to our elders, giving priority to those who are clinically vulnerable, giving priority to Indigenous communities. And this effort, which involves an enormous number of staff, of healthcare professionals, of healthcare workers, of volunteers, is a real achievement for all of us, and we want to share in that recognition today. You'll note from the numbers today, in hospital we've gone from a high in the 3rd wave of the COVID-19 pandemic of 511 people in the hospital to 286 today, a high of 183 people in critical care to 88 today, and this is good news, and it brings with us important news about the resumption of non-urgent scheduled surgeries. So I wanted to brief all of you on that today. We have a PowerPoint presentation, and I'll take you through that, which talks about the efforts that have been made so far and the efforts that are going to be made in the coming weeks. So let's go to the first slide. When I announced the postponement of non-urgent scheduled surgeries in the Lower Mainland last month because of COVID-19, we made the same commitment to patients as I did in March 2020. You are not forgotten, and we will get each of you the surgery you need. This is an assertion based on evidence and the remarkable work of our surgical system, our public health care system, and the people who deliver surgeries. I want to take a minute to share the progress with you now, as I think it's important and reassuring as we look to resuming non-urgent scheduled surgeries in Metro Vancouver that have been postponed in the 3rd wave. This achievement speaks to the significant progress made throughout on surgical renewal commitment. We are changing the way we deliver surgeries in BC by increasing operating room time and capacity. The result is that more patients are getting the surgery they need faster. Next slide. When we consider what we accomplished since June 2020, when all health authorities were fully operational after the first wave of COVID-19, we start to see the scope of the transformation, I think, that's occurring in BC surgeries. In this period, compared to previous years, we've completed more surgeries between June 26, 2020 and March 31st, 2021, 8,547 more surgeries, all during COVID protocols that made each surgery more challenging in order to keep people safer. We completed more scheduled surgeries. The focus of the surgical renewal plan, we completed 9,208 more scheduled surgeries. We performed the surgeries that patients needed most, holding true to our stated priorities. We completed 4,294 more urgent surgeries and 7,365 more surgeries for patients waiting more than 2 times the recommended wait time. In other words, not just focusing on reducing wait times at the beginning, but reducing the overall wait time, especially for those waiting longest. Through 74 initiatives across all health authorities, we added 21,966 hours of operating room time. We increased staff. Since April 1st, 2020, 1,459 healthcare providers have been hired to support surgical renewal. 391 surgical specialty nurses started their training, and 274 completed their programs. And 92 medical device reprocessing technologist students are in training, an important part of any surgical program. Next slide. Today we're also releasing, and on the government website you can find them, our monthly reports on surgical renewal. We're releasing reports 10 and 11 today, and they bring with detailed information for all of you, information up to March 31st this year. They deal with the period from February 5th to March 31st, and they're now available. On the slide, you can see one of the key milestones achieved. We have delivered surgery to 97% of the 15,154 patients who were called during the first wave of the COVID-19 pandemic and had their surgery postponed, and who still wanted a surgical treatment. So again, to those whose surgeries have been postponed in April and May, who are just postponed, you will get your surgery. You can also see that the total waitlist size has decreased to 81,940. This is a 13% decrease compared to March 31st, 2020 in a pandemic. In over just 8 weeks, from February 5th to March 31st, health authorities and care providers across this province performed 3,446 more surgeries and ran operating rooms an additional 6,667 hours. Also during this period, an additional 292 healthcare providers were hired. Next slide. I want to speak, when we launched surgical renewal in May 2020, we noted that our targets and timelines were highly vulnerable to external forces like a resurgence or future waves, and other factors over which we would have less control. We also said we would learn and adapt as we faced each new wave, and that we would manage any reduction of services differently than we did last March. And that's exactly what we've done. As the third wave brought dramatic increases in cases and hospitalizations in Metro Vancouver and started to take a toll on our hospitals and healthcare staff, on April 26, 2021, saw 9 Lower Mainland hospitals postpone non-urgent scheduled surgeries and focus on only on urgent and emergent surgeries. As of May 23, 2,153 patients waiting for non-urgent scheduled surgeries had their surgery postponed. I know that this causes tremendous anxiety. We know that every one of those surgeries is important, and we are tracking each one of them. And to these patients, I say this: you are part of our surgical renewal commitment, part of our BC Restart plan. Our surgical system is stronger than ever, and we will build on the progress we've made so far. Next slide. Last year, it took us 4 weeks to fully resume surgeries. This year, it will take us 3 weeks. All 9 sites across Metro Vancouver will be fully operational by June 7th, with actions to get us to that point starting this week. These 3 weeks leading to full resumptions of surgeries are essential. The 9 hospitals increased their ICU beds by moving into spaces traditionally used by surgical patients. These spaces and beds will now be readied for surgical patients. In addition, many staff were redeployed to support care of COVID-19 and other critically ill patients. They need time to regroup and prepare to deliver surgeries while still caring for other patients who remain in the hospital. Go to the next slide. So in Fraser Health, here's what patients and their families can count on. We have aimed to bring Burnaby back to full operations by May 25th, and we did. Between May 31st to June 4th, Royal Columbian will be back up to full surgical operations. And by Monday, June 7th, all 4 hospitals in Fraser Health, that's Burnaby and Royal Columbian, as well as Abbotsford Regional and Surrey Memorial, will be fully online and working to deliver the postponed surgeries. Next slide. In Vancouver Coastal Health, here's what patients and their families can count on. Between May 31st and June 4th, next week, St. Paul's Hospital will be back to full operations. And by Monday, June 7th, all 5 hospitals in Vancouver Coastal Health, St. Paul's, Lionsgate, Richmond, UBC, and Vancouver General will be fully online and working to deliver the postponed surgeries. In resuming non-urgent scheduled surgeries, we will apply the same principles we did in 2020. Patients needing surgeries most will have their surgery first. This includes urgent surgeries, patients who have had their surgeries postponed, patients who have waited more than twice the recommended wait time, and surgeries that do not require an overnight stay in hospital or that can be done outside the operating room. This announcement of surgical resumption is, of course, welcome and reassuring news to patients and their families, and I think to all of us. But as we consider today's news and the progress reported on the monthly reports released today, we should all know this: all those involved in delivering surgeries, the healthcare workers, those who booked the surgeries, our health sciences professionals, our nurses, our doctors, all of them are the authors of these achievements. But the co-authors of these accomplishments are each of us, every one of us, for continuing to use our COVID skills and continuing to follow public health guidance and orders to stop the spread. We can't let cases surge again and impact our hospitals and surgeries. We need to get registered. Register, 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 and we need to get vaccinated. And we need to think about what made this progress possible, and then keep doing everything we've been asked to do and are required to do, that everyone delivering surgeries is able to do the job that we're counting on them to do, and the patients get the surgeries they need. We need everyone to continue in this period where we're easing restrictions to follow public health orders and public health guidance, and we need everyone to register, all of you to register. In March 2020, we assured patients they would not be forgotten, and they were not. They weren't forgotten by me, they weren't forgotten by health authorities, they weren't forgotten by public health care, and they weren't forgotten by all of you. All of us have worked together to make sure that everyone who needs surgery in BC and who had their surgery postponed last year gets their surgery, and that we increase and reduce wait times for surgeries in our province. We need the same commitment to those patients who are affected in the third wave, and to those patients, to each of you today, I say this as well. We will be calling you again, this time, to rebook your surgery. Aujourd'hui, nous annonçons 378 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 143 264 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 7 nouveaux décès liés au COVID-19 pour un total de 1690 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 286 personnes sont actuellement hospitalisées, dont 88 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
All right, a reminder to reporters on the line, please press *1 to enter the queue. You are limited to one question and one follow-up. Our first question today comes from Katie DeRosa of Vancouver Sun. Katie, go ahead, please.
Hi, Dr. Henry. Is there a certain either percentage or number of doses that will be redirected to second doses? Like if we're sort of averaging 60,000 doses a day, will that supply overall, will that dosage increase, or will it be sort of a percentage siphoned off for second dosage?
Not really either of those. So what we have done is planned, and this is why it's taken some time for us to get there. What we've done is planned the appointments and the doses to each of the clinics based on the streams that we have on the go right now. So that's anybody from age 12 and up who's requiring first doses, and then we'll have second doses in those same clinics. So it really is about portioning out the clinic appointments and the vaccine to meet those appointments. So it really is kind of a large logistical challenge of making sure we are where we are now. We know how many people are in each of the cohorts that are due for dose 1, and now starting with dose 2 and where they are around the province. So we will be moving full steam ahead on both of those in the next few weeks.
Katie, do you have a follow-up question?
Yes, and for individuals who receive their first dose, for example, frontline workers or people living in shelters, correctional facilities, will they be contacted by public health, or do they have to register? And for example, there might be individuals who are more transient. Like, is there any concern about following up with certain individuals to get the second dose?
Yeah, so that is something, it will vary. We will be reaching out again to people who are in shelters. We've already started doing that in some cases, to people who received it through workplaces, etc. And we will be connecting with them. Certainly, we know most of the correctional facilities. So yes, we will be reaching out for those people. Having said that, it doesn't harm anybody to register, and it just makes it that much simpler. But we will be reaching out again to those people who received it in very separate situations like that. And for First Nations communities, for some of the more rural, remote communities where we went in and did a whole-of-community approach, we will be going back and doing clinics in those communities so people can access the vaccine that way.
Okay, our next question comes from Shannon Patterson of CTV. Shannon, go ahead, please.
Oh, hi, Dr. Henry. You said that there are new guidelines for religious services, but you didn't say what they are. So can you quickly tell us what that means as of right now, what's allowed in houses of worship? And would this include things like weddings and funerals, religious services that are held in churches that aren't so much Sunday service or Saturday service, but are events like weddings and funerals?
Yeah, so what we have done, and these are all posted, so it's on the PHO website, the new variants for indoor and outdoor, and the guidance documents that we've developed with the advice of faith leaders. So yes, it does involve indoor services up to 50 people. And it right now, as we're in this bridging period where we're still having constraints on numbers and other activities, particularly indoors, it has provisions for things like masking, etc. It does allow for small funerals and baptisms as part of a religious service, but not at the moment for weddings. Weddings are subject to the same restrictions that we have on indoor gatherings, so still small numbers, and they certainly could be held, but the number is limited to 10 people for weddings at the moment. But those are the things that we'll be working with faith leaders to move for the next phase of this. But right now we want to proceed slowly and carefully, and I know many people are looking forward to having going back to being able to have indoor faith services with their community.
Shannon, did you have a follow-up question?
Earlier this week, people in Ontario were given access to a easily accessible digital online record of their vaccination. And it's not something we have. We're just given these cards when we go to clinics or pharmacies that obviously wouldn't count as a real record. We also have nothing that's easily accessible on a mobile phone. It's something that was promised, I think, back in January, that there would be a digital record that was easily accessible as well as a physical record. Can you talk about where we are for that? Is it possible they may become something we need to produce in the coming months when we're fully vaccinated?
It won't be something you'll need to produce to access services, but it is something that we are committed to everybody having access to your own immunization record. And yes, that is in the works. It's very close. The immunization record, the traditional one that many of us still have, is a paper-based one, and that's why most people are receiving the hard copy one so that they have something. But from the very beginning, every single dose of each vaccine, as I keep saying, has gone into our provincial immunization registry. And yes, this whole system, our registration system, I know that's complicated because the registry and registration are two different things, but the registration system does allow for you and your care provider to access your immunization record. And that will be coming very, very soon. We're working out the final details of how you can do that. Your care provider, public health, can do that right now through our immunization registry, but people will be able to access their own records electronically. I don't want to give a time frame, but it's very soon.
Okay, our next question comes from Richard Zussman of Global. Richard, go ahead, please.
For either Dr. Henry or Minister Dix, we've heard concerns from retired nurses and now from paramedics that firefighters are providing the vaccine, in many cases being paid overtime to do so. Why is this happening, and why aren't retired nurses or paramedics or even current nurses being used on overtime to provide these vaccines?
Well, I can't talk about the contractual obligations that people are being paid for. There's a wide variety of them. I can say that we are employing, and there are many, many nurses, paramedics, physicians, a whole spectrum of people who are working in our clinics across the province, but maybe you can talk to them.
Thanks, Richard. I think the significant majority of vaccinations, I think, are being performed by nurses now. A very significant majority. I have that. I don't have that with me, Richard, but I'd be happy to share that with you and other members of the media and the public. But we also have a variety of different people performing immunizations, and we're very grateful for their support and their efforts, including firefighters who have been involved in these efforts as well. So can't really say, as the comparisons between one group and another, except to say this, that I think everyone, doctors and nurses and healthcare workers, pharmacists who have just been extraordinary, both those who work in the public system and community pharmacists as well. Our whole teams are doing extremely well. I know that there are challenges when you're talking about delivering, as we have, more than 3 million vaccinations in a short period of time, directed first and foremost to those most vulnerable. There have been real challenges, and I think our teams have done an excellent job putting people together. I know there's sometimes concern from one person or another about who gets hired, and that's part of the challenge of putting in place such a large operation. But the large majority of vaccinations have been by nurses, but obviously significant numbers have been done by other health professionals, especially, and in second place physicians, but other health professionals as well. So happy to get you more details on that, and it may be of interest to all members of the media, so we'll distribute that to everybody.
Richard, you have a follow-up question.
Thank you for that, Minister Dix. Much appreciated. A question now about self and rapid testing. As we move towards opening up more things, what is the plan for rapid testing? Could it be used for large venues like sports arenas or airports as we start seeing more traffic go through those areas? And Dr. Henry, have you given any thought to using larger amounts of self-test kits?
Yeah, so the self-test kits have only recently been approved for use in Canada, and I know across the country the testing team, including some of our lab scientists, are involved with that. Dr. Mel Krajden, where they can be used. I've been watching in the UK where they've been doing self-testing. What we hear from our colleagues is that limited usefulness in certain situations, where I do think it is important and where we will be continuing to increase the use of rapid testing is to support people getting back to work settings, communal living settings. So we've been using them, as you know, very effectively in places like our correctional facilities, when people come into correctional facilities, and particularly that we've done some pilot studies to support people going back to those communal living settings where if somebody's sick, it helps us understand right away whether it's COVID that we're dealing with or not. So that's where they are most effective right now, is identifying clusters and outbreaks early, and we're using them in a variety of situations to do that. And that will continue. The BC CDC is leading a group that's been working with businesses as well to see where these might be useful in businesses as they reopen in the coming weeks as well. So there's many different settings where I can see them being of value. We are also working with the federal government, and there's a report that just came out about an hour ago. I haven't had a chance to read it yet, about use of rapid testing at airports and travel. And I know they've been looking at that, the federal task group on rapid testing. So we'll be looking at where that fits in to our program as well. Adjunct or added on piece to the core of more accurate PCR testing.
Our next question comes from Lisa Eusda of News 1130. Lisa, please go ahead.
Hi, sorry, taking off mute. With these vaccine second doses, is this like the final frontier that we're facing to get back to life as we know it? You know, people talk about Melbourne now and they see them locking down, but their vaccination rate is a smidgen of ours. So once we get these second doses heading into the fall, is that going to be it? Maybe a booster shot somewhere down the line, or is there possibility of another, COVID brick in the head coming our way?
I wish I knew the answer to that. I think for at least another year, waiting for those bricks. You know, there's a couple of things about it. The first dose, and this is, you know, how we've been approaching this and looking at this, similar to some countries around the world. The first dose really is about giving everybody a very high level of protection as quickly as possible. And we know that that works. I've presented the data, you know, the vaccine effectiveness is at least 70%, which means in the real world, for people over the age dose protection. So that's the good news. Second dose really is about giving that added level of protection, another 10 to 15% to you as an individual. But it also does contribute to our collective protection. But it is much more about the individual protection, and that's why we've gone back again to ensuring that people who are most at risk are getting their second dose first. But we do know that there are pockets where even the first dose is low, and it is going to be important for us to keep on pushing the importance for an individual, for your own protection, to allow you to get back to doing things, but also for the community to have their first dose. And there's some parts of the province, and you can look on our interactive website to see where those are, where we really do need to continue to step up. And places like Melbourne are examples. There's a couple of other countries that have very high first rate immunization and even second dose immunization, like Malta, for example, where they continue to have clusters and outbreaks that lead to people being hospitalized, to deaths even. So we need to pay attention to that. Getting the second dose does protect me better, but it protects all of us better, and we're moving that up for a couple of reasons. One, because we want to get all of the protection as high as we can when there's still a lot of transmission happening in countries around the world, and we can have introduction of newer strains, so that's important. But we don't yet know if we're going to need booster doses at some point, or if some people will need them, if some people will never mount enough of a protection response on their own. What we do believe is that as we go into the fall, we have high levels of protection in the community, high levels of second dose protection, so that extra bit for all of us, that we should be able to get through this respiratory season. We may need at some point to have a booster dose. We don't know yet. This virus is mutating at a slower rate than things like influenza, but it is changing, and we've seen that with these variants, where sometimes if there's a lot of transmission of the virus and more mutations, some of them will confer a survival advantage or a transmission advantage. So that's what we're seeing around the world. We're seeing it in India, we're seeing it in Brazil, in countries where there's a lot of virus circulating. So we need to get as high a level of protection as we can in BC and in Canada to protect us as this virus is still circulating globally. What might happen, and what we are watching for and will need to continue to watch for, is if a strain arises around the world that where it is not as amenable to the protection from vaccination. So that's something that we can't predict, but we need to be able to monitor for, and in that case, we may need to have a booster dose sooner rather than later. So all of those are possibilities that I just don't have answers for, but that we've been thinking through where they might lead and down the line, and what the responses to those might be. That's why it's still so important to ensure that we have other vaccines that are in development, even if it may be some time before they're approved for use. And I'm thinking of Medicago and the Novavax. It's also why we need to really continue to push on having domestic vaccine capacity in Canada to be able to develop booster doses if we need them.
Lisa, did you have a follow-up question?
I sure do, regarding masks. I know the mandate is ending on July 1st. Wondering what guidance you have to businesses that will want to keep masks in place, either for their employers or employees or their customers or both, how that might work, and if, you know, and even going back to university in the fall, if universities want to say, like, you need to wear masks, how do you foresee all of that working without a mandate in place?
Working very much the way it did last summer when we had low rates of transmission in BC. So it is all proportional. The mask is the last level of defense. It's the last thing that we have that that stops us from transmitting to others and others transmitting to us. But it is most important where we have high rates of transmission in the community, because you don't know who you're coming in contact with. As rates go down, it becomes less and less of an issue, particularly in some situations. But absolutely, it needs to be a slow progression. We should still be wearing masks in indoor, common public spaces if there's crowds, if we can't keep our distance from somebody for those short periods of time. So I envision that even though the legal mandate isn't there anymore, that we will go back to using masks as an important piece of keeping others safe, showing respect, particularly when we're in those settings where transmission can happen more easily. So looking at public transit, indoor public spaces where we can't keep our distance from others. And it goes with those other personal things that we need to do from now on, at least for the next period of time until we understand how COVID is going to be with us for the future. And that is things like covering our mouth when we cough, cleaning our hands regularly, staying away from others if we're sick, all of those things that we need to keep doing forever. We'll never stop washing our hands.
Okay, our next question comes from Rob Monroe of Info News. Rob, please go ahead.
Yes, thank you, Dr. Henry. In the central Okanagan in the last week, the number of cases has gone up. And the concern here would be, it's a destination place. I know people from Alberta are not supposed to be coming out here for recreation, but they probably are. We see a lot of plates. Is there some concern that areas like the central Okanagan are a bit more vulnerable to people coming in here? And we also have a large number of vaccine hesitant type of people here too. Is that a concern?
So we've been looking at that. I've been talking with my colleagues in Interior Health. But what your last comment is the one that we really need to focus on. It is vaccine that protects us as a community. And we've seen that in places like Windermere and Revelstoke, where we started to see a lot of transmission in those communities. And immunization made such a tremendous impact that we saw that drop away. So protecting us through immunization is what we need to focus on right now, knowing that there is still virus circulating. And I know there's been a couple of clusters where there's been transmission between groups of people that have not yet been immunized. So that's something that we need to pay attention to. But the other half of it is that we go back to how we manage other reportable communicable diseases, or things that spread between people. And that's the public health management of cases, people staying away from others if they're sick, and also if you've been exposed, to be self-isolating. And public health right now is supporting people to do that. So that contact tracing, that managing of outbreaks and clusters and preventing them from spreading. And the thing that prevents them from spreading widely in communities is people being protected through immunization. So we need to absolutely encourage our friends, our family, for their own protection, recognizing that we can't stop everybody from coming into our communities. And right now, there's still virus in BC, in Alberta, across Canada, and globally. So we need to protect ourselves through immunization and protect our communities by all of us getting immunized. So.
And just, Rob, with respect to the Central Okanagan, all of the Central Okanagan Community Health Service areas are over 50% vaccinated. That's on a base of 12 and over of about 62%. But some are on the lower side, and we're going to be making some efforts. I know Interior Health will be making some efforts to increase the level of vaccination in community health service areas such as Rutland and Lake Country. I want to encourage everybody who lives in Interior Health, but particularly in the Kelowna area, this is the time to register and book and get your vaccination. I think that's important. Just with respect to a previous question, you asked about what proportion of vaccinators working at clinics are in different categories of professionals. It's different by health authorities, but I'll just give you a quick sample because I know some of you are on deadline. Vancouver Island Health 52% of them are physician midwives and nurse practitioners. 46% are registered nurses, registered psychiatric nurses, or LPNs. And so that's what it is in Island Health. In Vancouver Coastal Health, it's 51% nurses, 29% physicians, and a variety of other professions for the rest, including many pharmacists. And in every category, lots of medical students and student nurses who've been just extraordinary, I think. In Northern Health, it's 85% nurses, 10% or 15% either physicians or community paramedics. In Interior Health, it's 85% registered nurses. In Fraser Health, where there's the most diversity of professions, 43% registered nurses or LPNs, followed by physicians at 22% and firefighters at 16%. Really, it's in Fraser Health, which is the primary place where we've used firefighters. And of course, we've been mounting an exceptional immunization effort there. So that gives you a sense, and we'll be sharing this, but it gives you a sense that really everywhere across the province, the largest proportion of our immunizers are nurses, and people know this because they go and get immunized in our nurses, but all of our professionals have been working on this, from physicians to firefighters to pharmacists who've done a great job, especially in the community program with AstraZeneca. All of them have done an exceptional job, and we're grateful to all of them.
Rob, did you have a follow-up question?
Well, just sticking to the central Okanagan and that fairly low rate, around 50%, I think you said, Minister Dix, versus 68 or something for the province. And again, we've had all these protests here and rallies against masks and vaccines, and that Rutland's been a high transmission, low vaccine rate place for at least 3 weeks. What's going on here? Is there more needs to be done to deal with these anti-vaccine messages that are coming out from places like here?
Yeah, there always is more that we need to do to counter some of the misinformation and disinformation that is out there, particularly around vaccines. And that is something that we are working on, not just in Interior Health, but other places as well. I think we need to also put it in the context of the age structure of communities. And there are many communities in the central Okanagan, for example, where it is younger people more than older people. So that's one of the reasons why the rates, because people have not been eligible for vaccination until more recently. So there's a whole bunch of different factors, but you're absolutely right. We need to address it by community and community approaches. And I know there's a lot of work going on with local leaders, municipal leaders, faith leaders, and others to try and support people getting access to vaccines. And the other thing is that access. I know for some people it's a challenge to think about registering and then going somewhere to get their vaccine. So we're looking at our ground game. How do we get the vaccine to people? And now that we've reached that certain level of first doses across the province, we'll be looking at many different strategies, and different communities will be slightly different, but how do we get vaccine to people who may not be bothered going into town to get to the clinic, etc. So those are all strategies that new and different things in different communities in the next little while. We've already started some of them in places like Surrey, as you know. On the island, they've started some, and I guess in the interior as well. Okay.
Just one point. When we said, and the lowest is Rutland, which is, I think, 50.8%. That's 12 and above, so that's 62% province-wide. Most of the Kelowna area is in the 55, 56, 57 range, so just below the provincial average, just a little bit. So we've got to make a major effort, but it's not significantly different than other places. But we're going to be continuing. I know Interior Health and a lot of leaders in Kelowna are going to be making, and the Kelowna region, the Central Okanagan region in general, are going to be making some efforts there. But we're not. It's not like it's 50% and 67%. That's not the gap here. But we want to do better in the Central Okanagan.
All right, we have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher, CBC. Please go ahead.
And for second doses, beyond the priority groups of clinically vulnerable and then starting with 70 plus, what about those who were bumped up earlier for dose one because they lived in a hot spot? Does that mean they'll be bumped up again accordingly? And will second dose clinics be set up in hotspot communities?
The short answer is yes. So it's all going to be phased in the same way it was done for dose one. So it's based on when you received your dose. And so for some communities, we think of Prince Rupert, for example, where we went in and did the entire community approach. That will happen for second doses, and that will be coming up very soon. For other communities, it's not that easy. For some of the larger communities, the hotspot ones we identified more recently that are larger, it just means that people will receive their invitation to come for their second dose sooner. And so everybody will be moved up to 8 weeks at the latest. So if you just received it early in May, then you should expect to receive your second dose invite in early July.
Tanya, did you have a follow-up question?
Please. And for my colleagues, if we could get a response to both questions in French, that would be great. Thank you. Can you give a bit of guidance to people who might have unvaccinated people in their social circles? Should masks still be worn when visiting inside with people who haven't yet had one dose? And what's the level of risk for an unvaccinated person to be around someone who has received one dose?
You know, this is where we should be encouraging those in our social circles that this not only protects them, but it protects all of your people that you're in contact with or that you want to be in contact with. And it is the key for us being able to protect each other. So we still have virus circulating. We had another 300, almost 400 cases today. But the risk is different in different parts of the province, and when we are expanding our small, close social network, we should know the risk that each of us has. And certainly if I'm somebody who's immune compromised, who's non-immunized, have close contact with them indoors right now. And so those may be relationships or visits that you want to postpone until we are at a level that in the community that's lower, or until that person has that protection from vaccination themselves. So yes, masks are still a very important part based on our own risk, both our risk tolerance, our risk ourselves, but the risk of those that we're closest to and around. And right now, we should be keeping those groups small. And yes, it makes a big difference whether you're protected or not. We know that this vaccine prevents 70% of infections on a community basis, and it prevents, if we do get sick, we're less likely to have severe illness, and we're less likely to transmit it to others if we've been immunized. So very important. It protects me, but it protects people around us too. And for young people who are worrying about this, this is the key to us getting back our lives again. It's the key to being able to do those social connections, to having those close contacts that we all are missing so much. And that's going to be important as we move into step 2 and step 3 in the summer.
Ce qui est essentiel, c'est d'être vacciné, n'est-ce pas? Et la première dose est importante, la deuxième dose est importante aussi. Et je pense que ce qui est important pour ceux qui sont dans votre cercle social, c'est d'utiliser votre influence aux gens pour leur convaincre d'être vaccinés. C'est important pour eux, c'est important pour vous, parce que si on est même un peu vulnérable, il faut prendre cette situation, la question de la vaccination de nos proches, de le considérer de toute façon pour chaque interaction sociale. Donc, le clé actuellement, c'est d'être vacciné, et on espère que tout le monde va. C'est simple, ça passe vite, et c'est important, c'est essentiel. C'est votre contribution à la santé de tout le monde, mais surtout à vos proches. Donc, il faut faire attention à cela, surtout quand on est vulnérable. Aux questions de deuxième vaccination, bien entendu, on va utiliser la même formule que la première fois. Ceux qui sont des personnes de troisième âge, bien entendu, mais aussi ceux qui sont les plus vulnérables. On va continuer cet effort. Donc, mais dans un cas d'une communauté comme tel Prince-Rupert, où on a fait une vaccination quasi complète de la communauté, ça va venir dans 8 semaines après et on va répéter cette expérience pour la deuxième dose. Dans d'autres cas, ça va être plus difficile, mais ça va dépendre de la première dose. Donc, tout le monde va avoir accès et on espère que tout le monde va recevoir la deuxième dose, leur deuxième vaccination, je veux dire, avant le commencement du mois de septembre. Merci beaucoup. Thank you very much. We'll see you on Monday.